Okay, sweet. We're going live. Could you actually tell Devin that I used that one? Yeah, she'll be like, what? You said you were going to. Okay, cool. So, like the phases of postpartum healing. Do you guys have the book? If I knew you were coming, I would totally just give it to you. So you could leave with a copy.
Oh, yeah, I do have your book.
Okay, so it talks about the phases of healing. I don't know if you've gotten yours yet.
It just
did it yesterday. Look at that. But really, when we talk about like healing our bodies, the first thing we have to do, and it doesn't matter if you're 20 years out from birth, because if you never heal the scar tissue, you still have scar tissue. That's just how we work, right? So the very first thing is identifying the tissue that needs healing. So this could be like if you had any tearing vaginally, if you had a C-section, that would be the C-section scar, any trauma to the tissue. So sometimes people have like tears or just like little micro tears in the tissue. So how do we heal? How do we heal that tissue? I love it.
No questions here.
Oh my goodness. This is my favorite age. Yeah,
It's so
I
sweet.
love it. I love it.
She crawls too, all over.
I love that. Don't let her crawl under that table. Oh my gosh, I love it. Okay. But so we want to heal the scar tissue. So even if we had, like when we stretch drastically, did you do any pelvic floor work prenatally? Okay. So even when we stretch drastically during the labor process, and I didn't even introduce you guys, this is Victoria. She's another provider here. So she was just free this hour. You haven't met Katie. Katie used to come here. Yeah. So when you stretch drastically here, the tissue gets little micro tears in the muscle and in the fascia. So even though it's not like you were stitched in this third layer or in the deeper layers of the pelvic floor or the vaginal canal, you will still have micro tears in the tissue that you want to heal. And we want to heal them because we want to get full range of motion back of the bottom of the core, which is the pelvic floor. So pelvic floor is 3 layers. I don't know how much you know, but Phoebe is also a physical therapy assistant.
Oh, very
So,
cool.
yeah. And so first layer are these muscles here. So this has clitoris in it, and this is where a lot of the stitching occurs. So if you had any tearing, a lot of times it's in this perineal body area. Sometimes it can be higher up by the urethra, but we want to make sure that tissue gets healed. You can start doing your own tissue work and like starting to touch that tissue as early as 6 weeks, and you should, because that will stimulate the healing. A lot of people get freaked out by that though, and they get like the heebie-jeebies. It's your profession, so I feel like you're probably confident with that. So just start to touch it and just like get the sensation of touching it. If that scar is scary, even though like I do this for a living, like when I started touching my scar the first time, it's like, oh yeah, okay, like that's there. Like I gotta like get this better, and you want to get it moving in all directions. That's really like the goal of healing any scar tissue in this area, is to get this range of motion of the pelvic floor back. Because that's where all the strength comes from, is how elongated we can get this muscle. It's not how tight we can get this muscle, it's how elongated we can get it. Then the second layer of the pelvic floor is more fascial, and it has a urethral sphincter. You can't see it here. And then this is the third layer, where a lot of the micro tears from birth will be. With the micro tears, a lot of times the patterns that happen are the tissue just tightens further around the scar tissue or further around the micro tears. So we end up with a tighter third layer. So less movement in that layer. So if you're comfortable, you can also do a wand. So that could be something that you do instead of getting like internal work done. Although I truly believe like one session at least, so then you can start to map your own, and get things like, you'll find where your scar tissue is, and just having someone else touch it and move it around, you already know. It's like, then you get comfortable with like, okay, yeah, I can feel that. Like I can do that myself. But that is in the third layer. We want to get the motion. Cool. So that is this first phase of healing. And if it's in the belly, so like if we have scar tissue in the belly, we want to get that tissue mobile again. A lot of times what happens during pregnancy, does anyone have any diastasis, the ab separation?
I think mine mostly just healed right up with TA work.
I was going to say.
So
if you know how to work TA and you kept it going like we did during pregnancy too, then a lot of times your diastasis just recoils beautifully.
Mhm.
A lot of times what you'll see though is people that still have some residual,
I haven't checked it for a few days,
Um, is that they tend to be more oblique dominant. So they really use their obliques more.
Mhm.
So a lot of the tissue healing that we would do like in this first phase would be a lot of abdominal work to get the tension and the tone out of the obliques,
Mhm.
and then work to train the TA.
Mm.
So then that helps to heal the core. So that the core, let's just do like a full core picture.
Mhm.
So, and these are like the most essentials for postpartum healing would be your pelvic floor.
Mhm.
Okay, so the bottom of the core. The front is the TA, so that lower abdominal muscle. Do you remember that one?
But
When
yeah,
you like
that was hard.
you get that muscle to activate? Okay, so that is the lower TA. Really, as simple as this sounds, like just it even at 9 months. Like
Mhm.
I do this even at
Mhm.
2.5 years.
Uh-huh.
Is that when you you just get that nice contraction of the TA. We use the exhale to stimulate TA, the SH sound, because then it's going to give more of a lifting to the bladder, and it will help decrease the intra-abdominal pressure. And so we'll have more TA activation with that. So that's the front of the core that we focus on like the most for rebuilding.
That's the noise I do the whole workout class.
And you should. You totally should.
And you feel a little weird, but
Yeah, no.
I think that's why I feel like my core's felt so much stronger, because I'm doing that the whole workout.
Exactly.
Yeah.
And that is exactly what you should do. And that's why every single exercise you do is actually a workout or a core workout.
Yeah.
Because if you're doing the breath pattern, then it becomes like you're using your core. So one of the things that we teach is the blow before you go or blow as you go. So it's exhale with all exertion. So and just start implementing this the minute you wake up in the morning. So even when you like go from sitting to standing, and especially when you're holding baby, you shh as you go up. I do it to this day, and my husband still makes fun of me. But like everything I do, shut the car door, like it's just part of the mechanic. I have a prolapse, and so it's just what I'm gonna do for the rest of my life to keep the organs inside of me. And you don't know the positions of your organs yet, but when you go for like your initial assessment, she'll check that, and most people have some degree of heaviness or some degree of descent after having babies, where their bladders come down a little bit, or the rectum comes down, or the uterus comes down. So the exhale helps lift it up and take the intra-abdominal pressure off those organs. Does that make sense?
Yeah.
You want to make sure that when you you feel it lifting up, and it's not a bearing down sensation. You can test that yourself by just like sticking a finger right inside vaginal canal if that feels comfortable to you. That can be like a self-check. Like, okay, am I doing the TA right? And is the breath actually lifting? Because sometimes we will see people will like work really hard to TA, but they almost tuck a little, like a shh here. And when they tuck with the TA, so posterior tilt with the TA, they'll drive their bladder down, and they'll actually like cause some descent. And so we don't want to do that.
Yeah.
So when you're doing the exercises, like as long as you're in good alignment and you're shushing, then that's beautiful. Yeah. I got distracted. We were at the front of the core though.
Yes.
So we were going through all the pieces of the core that you're going to want to rebuild and then integrate all together. And so we talked pelvic floor, we talked lower abdominals. Now for the backside, the butt. So many moms have like flat butts. It's like a thing, right? Good thing though is that building a butt has become back in style with the Brazilian butt lift.
There you go.
Right? Like it's perfect though, because the butt is what will save your pelvic floor for the rest of your life. The reason we lose our butts during pregnancy is because we lose hip extension. So we don't have that like ability of the leg to go behind the body, because we start to like waddle, and like the load is here and we externally rotate. So we just don't utilize the full hip extension. So one of the big things to get back in when you start to do things is to get the hip extension. So you can do things like bridges, or even just doing squats. You're getting hip extension. Single leg deadlifts are good for hip extension. You might not have the stability to do single leg work yet, especially you as you're building up. But if that starts to feel good, that can be some good stuff to like get your glute med going, get the butt going. A lot of times what happens during postpartum, and the reason we see a lot of SI pain during postpartum, is because people start to move and do their squats with their pelvis.
Mhm.
So they're doing more of like a deadlift with an anterior tilt instead of doing it with just a hip hinge. Does that make sense?
Yeah.
So you just want to make sure that the movement, you're feeling it in your butt. You know that if you're driving it from your butt and you feel it in your butt and not in your back, that it's in the right spot.
Yeah.
Does that make sense?
Mhm.
So build that booty. Can you feel your glutes go at F45?
Yeah, when it's not every exercise, I
Yeah.
feel like it's always as focused on that. But
Yeah.
the other day we did have more squats and deadlifts, and it was a good coaching moment that they were like, we need more hips back.
Good.
So they were really
That's
trying to encourage that, and I definitely felt it after.
Yeah. No, that's awesome. And like, just go so light. So like, make a squat here. Feel like, okay, press the ground away, so you can feel the glute, and like get your mind connected, because it's irrelevant how much you weigh or how much you weigh, how much weight you lift.
Yes.
If you can't get that connection, like, or if you're like, oh, I just feel this in my quads and my hamstrings. It's like, okay, well, we're not getting your butt to fire.
Yeah.
And your butt is the one thing that is gonna really truly protect the pelvic floor. So when we talk about rebuilding the core, pelvic floor, lower abs, butt, and then diaphragm as the top. So diaphragm is the breath work. We'll go through like some breath work in just a minute. And then the missing piece for a lot of people is the lower traps and the lats. So when you can engage your lats and your lower traps, say in a squat, what you're also doing is lifting up your pelvic organs. And so if you start to feel pressure, pelvic pressure, so like if you feel like something's in your vagina or something's heavy, or you start to have some incontinence, and it's not uncommon for you not to have incontinence now, but to start having incontinence in 6 to 12 months, just because of how much change your body has had. And if that's one of the things that happens, one thing you can do when you're like working out or when you're starting to integrate exercise is really work on the lats, because the lats paired with your breath, the shh is going to help integrate to create this whole core canister and help lift those organs.
Interesting.
That makes sense?
Yeah, I don't think I had heard that part.
Yeah. So when you're deadlifting at F45, just like push into your limbs as you do it and make sure that you get your lats going. And that just has a really nice upward effect on bladder.
Interesting.
Yes. Cool. Even if you're doing like a lunge or something, it's like just like if you can pop your chest so you're in a better position and you feel like your lats are engaged, that's going to take off pressure here. Cool. Take a sip.
That, and I feel like I have to really think about like pushing through the heels.
Yeah.
Like to engage the glute more than just letting it be quads or whatever in one of those moves.
Yeah, you can totally do that, and that's what everyone is trained to do.
Is that not it?
And so, well,
wait, tell us, Dr.
I
Jones.
am going to tell
Okay.
you. We get our glute med. So this part of the glute, the upper glute, which
Okay.
people have a really hard time building.
Yeah.
We get that from going into a full extension and toe off.
Okay.
So one of the things you have to repattern is how you walk after babies, because we all start to like do a little bit more huddle.
Okay.
And so you have to forcefully work on like actually walking with a slight almost inward rotation. So with your feet forward, it might just feel like you're like, I feel like I'm so pigeon-toed,
Yeah.
even though I'm just walking normal. And so you have to consciously think about pushing off with the toe. There is a reflex that goes from your big toe to your butt that kicks on these muscles in like a functional pattern.
Okay.
So you want to, so when you're squatting or deadlifting, you really want to engage the whole foot, because you want to train your squat and deadlift. And this has taken me years to like be able to articulate, because I used to train like, just all on my heels, driving through my butt, squeezing at the top. But the more that you can get like neutral and train in like a more like functional position, the better it's going to be for your SI and your back, just from like a long-term perspective. So when you're squatting, try pushing through the insides of your arches and your big toe here. So you're really pushing through all of it as you come up, and not just your foot.
Is this like a barefoot shoe required movement, I feel like.
I get better sensation that way.
Yeah.
But you can play with it either way. If you imagine, this is so gross that I'm showing my foot
Oh,
to you guys.
but
But
maybe for the live stream, I don't know how you feel.
they can't see the
Oh,
foot.
okay.
They can't see the foot. But like if you imagine that this is a triangle. So
Yeah.
here's the thing,
Mhm.
and then here's to drop. You almost want the triangle to like squeeze together to become a small triangle,
Mhm.
and then it flares into the ground. So you want your full foot engaged during your squats. Play with it.
Interesting.
It takes like when I started deadlifting like this and like doing any functional movements like this, like I would literally just sit there and be like, okay, press, and like, can I feel my triangle? Like, is it squeezing? Okay, am I squeezing the triangle as I come up? And now I can like totally fully recruit, but it's like that slow of a movement that it's taken my brain to pattern that.
Yeah. Even thinking about it right now, I'm like, how do you do that without curling your toes?
Yeah,
I feel like I want to curl my toes
Yeah.
thinking about that.
No, for
Yeah,
sure, practice.
Interesting.
But even like PTs will still train you. Like I was trained to like push through your heels, screw your heels into the ground. But that just screws into this like external rotation pattern, which isn't necessarily like terrible. It's just not functional. So it doesn't carry over into how we want our bodies to move and like work for us. Does that make sense?
Yeah, that's really
So it'll wear out your hips faster if you like always are in that like external rotation, and lead to more back pain, shorter glute muscles, things like that. Is that helpful talking about this? But just play with how you push your foot from the ground.
Okay.
And play with that as you start to rebuild, and especially into like some hip hinge or some squats. You don't want to cause an impingement, of course, but just start to play with how your foot is contracting with it, because you'll go into your next pregnancy and your next one with that like external rotation pattern if you don't like become more cognizant of it.
I'm already my right hip has always been externally rotated.
Yeah.
So then waddling got very
Yeah.
rotated.
Well, Teresa, for the last 2 years, I've been having to change my gait. And and I'm like, really like, oh no, it's completely affected. If it took any back pain I ever had or consistent SI pain out of my back, because now my hips are in alignment. But for my whole life as a hockey player, like I was always externally rotated. But then when you have babies and you live in that pattern, then your pelvis, tell me if this is too much information, but like your pelvis then stays in what we call an open birth position, and it doesn't get the chance to close back together. And that's where you see like women that are like mid 40s, 50s after they have kids, and like they're like, that's when their sciatica, now they have sciatica and they have a hip replacement. And they've had all these things because their pelvis has never got to heal.
Yeah, this is my mother-in-law right now.
Send her in.
She's in San Francisco, but
I can send her to someone there.
Oh, there
I
you go.
actually just got a new referral source down there. So
really?
yeah.
Okay, well.
maybe. If she's
It's really bothered her. Like, it has to get the injections. What is it?
cortisone.
Yeah.
Yeah. I mean, that's just the start of it. And then it's like, replacements and all that stuff. Okay. We're going to go through like some of the rebuild stuff that you already know that we like do during pregnancy. Maybe if this is, if it's, I'll just kind of talk you through it. Hopefully it's opening, like you make sense and stuff.
Yeah.
But before I drop into like some of like the tactical exercises that we'll do, the big thing is obviously take care of that scar tissue. If you have, did you care? I can't remember. Yeah. Just start playing with that scar tissue.
Yeah. I guess I didn't hear that before or remember it. But
because you did this work during pregnancy though, like you have such good, you had such good blood flow to that tissue that the healing in scar tissue is probably a lot less than someone who hasn't had that extensibility. The big thing with like the reason we want that extensibility of the pelvic floor and why Kegels are archaic and not helpful is essentially like the length tension relationship. All the power is from the pelvic floor comes from the opening. So every time your foot hits the ground, so if I'm walking here and my foot hits the ground, naturally I should have a slinky effect with my pelvic floor. But if it's just tight and like stuck in like a semi-contracted space, which a lot of pelvic floors are, then it doesn't have that slinky recoil effect or like piston effect, if that makes sense. So that's why getting the scar tissue is so important, and like getting that motion is so important. And that's what we work on a lot, like during the pregnancy. And so it's easier to get baby out of birth canal.
I don't know whether, not to make this about me,
No, yeah.
but I just had my 6-week appointment, and during it, I got one question answered because they're like, "Oh, you have a lot of, I think she said granular tissue or whatever it was." She's like, "Is that really sensitive?" I'm like, "Yeah, that's been really sensitive." She's like, "They're gonna burn that off," which is what they did. So I didn't know whether to say yes or no. It was more like, "Yeah, this is how we get rid of that." And they're like, "So give this at least 5 more days to heal." So that just happened yesterday.
So sorry.
But I don't know whether then how that
It just
also
means you have scar
affects.
tissue.
Okay, so
Significantly.
extra scar tissue. Gotcha.
Yeah.
Cool.
Yeah, but that is so uncomfortable.
Yeah, it wasn't super fun. It wasn't as uncomfortable when it was happening, more like the rest of the day, because they're like, "Yeah, it's a chemical burn, so you're gonna keep feeling that." And I was like, "Yeah,
Yeah.
I feel that."
Yeah, sometimes they'll leave granule tissue and see if it'll heal on its own with scar tissue work. Sometimes they'll take it off right away. If it's like a lip of tissue, it's not going to recoil by itself. They have to take that off. So
She said it was a good amount. So
yeah,
then
so if
that's
it was a
maybe
good
why.
amount.
So, but okay, so
that's
just
not uncommon.
Work into that a little extra.
Yeah, I would just like hold off on sex though, and not do anything like that for like in my fullest opinion, like probably another 4 weeks. But it's totally up to you. And if you start to move that tissue and you feel like, okay, it's not as sensitive, I can feel it. And you can start, even though it's granular tissue healing, you can still start touching it. Or if that's not even comfortable, just take a Kleenex. I don't know where my Kleenex is. Oh, here. Take a Kleenex and just start touching it. Just give it a little desensitization. And I would start that now.
Okay.
Did they give you anything to put on it?
No.
Okay. Yeah, so I would start that now.
I have the Earth Mama
Perineal balm. Perfect.
which I hadn't been using as much yet because I was just like, I don't know whether I want to like physically put something on there if I don't know if it's all healed. But
Yeah.
now that makes sense.
Yeah, you could do that, or even a topical vitamin E.
Okay.
Just to like start getting it some tissue. You can also just use coconut oil. Like that's honest. Oh yeah.
Not
Coconut oil for you.
Different
Good
one.
thing.
Yeah,
Different oil.
Olive oil.
Yeah. Oh, yeah.
Yeah. So definitely not coconut oil. Oh, she's just perfect. Yeah. Yeah. So that's the reason to like start getting that tissue healed, and then where to start after that tissue healing, and to really not ever stop is the breath work piece. So there's 2 types of breathing patterns. Well, there's more than that, but like the 2 common ones are lateral costal breathing. So where you hands are on your ribs and you breathe into your hands here. So and then you exhale. So that type of breathing, once you're postpartum, your ribs are flared and we want the core to come back together. So we don't work the diaphragm necessarily in that plane as much. So what we want to focus on, and it doesn't mean it's bad breathing. A lot of Pilates studio, that's like a Pilates style breath. You can definitely do that and train that type of breathing. But when you want to train the opening and the reopening of the pelvic floor and the extensibility that we're talking about, you want to do more of a diaphragmatic abdominal breath. And then, and you know this one well, but you have your hand on your belly, you can have a hand on your chest. When you deep breath into the hand on the belly, and then exhale, when you breathe into this hand here, the pelvic floor opens, and that's what you want to feel. Have you done this type of breathing?
Yeah, it's like a yoga breath.
Yes.
Yeah.
Exactly. And so when you're doing that type of breathing, you want to think, okay, is vagina opening? Deep breath in. Inhale. Okay, can I feel vagina opening? Exhale. Do I feel some recoil? And then, or can you connect better to your anus? And you kind of want to like test it out, see where you have better connections. And then this is exactly how you want to initiate bowel movements. And so when you get the urge to have a bowel movement, I love it. I love it. It makes it totally amazing. Yeah. This is such a side note, but do you still talk to Courtney? Cortland? The Cortland.
Yes, same.
Oh.
I knew who you meant. Yeah.
No, it's not okay because I just wrote her name for like hours and days in my book.
Oh, but I figured that's the first thing I was like, are we talking about somebody?
Yeah.
But
yeah. Same person.
Oh yeah, no, she's my girlfriend.
Okay. We're gonna do a book release party, and like I'm inviting the people that were in the book,
Oh,
and you should come too.
Oh, I'd love to.
Because like her story is so epic.
Oh, her story
like,
is epic.
yeah. Yeah, and you're
but
totally
you know
welcome to
she's
come
pregnant
too.
again.
No. Are you serious? Oh my gosh, she has to come. I'm so excited. Okay.
Yeah. And
Good.
she has a little belly already. It's so cute.
Oh, I hope she comes back. I want to see her. Oh, she's so fun.
I
Anyways,
know.
her story's in the book.
Oh, that's so cool.
Is any of your other friends? I don't know. You guys all know each other.
I know we have
So,
a good crew.
sorry, that was a side note.
No, that's
It'll be like April 26th. You should totally come.
yeah, I would love to come.
It'll be like an evening thing, but she can come too. Okay, that was a side note. Where are we at? We're talking about bowel movements.
Bowel movements,
Okay.
breathing.
Bowel movements postpartum. You're still in the thick of it. And you don't have to answer this, but keep your stool so soft. So magnesium, raw psyllium. If you're on any stool softeners, you want to ease off of them by using raw psyllium and by using magnesium. So you're not relying on the softeners or stimulants. And we want the stool to be such a good consistency that you can just breathe it out without having to push it out. Because a lot of times people prolapse in the first year postpartum because their organs are just heavier and they start getting more constipation and start pushing their poop out. The organs, and this is when I said like the abdominal work or like the visceral work, when you're pregnant, the organs shift out to the side. So the colon gets shoved out to the side, the liver gets shoved up here. And so digestion takes a long time to just, you might have normal bowel movements, but things haven't fully recoiled back. And as the core comes back together, the visceral motility and the peristalsis gets more normalized, but that takes time. And so we want to get these organs moving very, very well. But so that's why keeping some supplements like that, like a magnesium or the raw psyllium can be really, really helpful. Or just a lot of fruits and vegetables, but it's sometimes hard to do that during postpartum. So pooping, like my fear is the little up and down, just like
I will.
Pooping is going to be like this. Anytime you get the urge to poop, you want to go within 15 minutes. No matter what, try not to delay. You want to, if you delay, then that can decrease that reflex that tells you have to go poop. When your kids get older, like this is how you're going to want to train them to poop too. When you have to go, you go. You do not hold your poop. When you have to pee, you can hold that. You can hold that for 45 minutes. Delay the pee all you want. It's an easier muscle to stretch. The colon, we don't want to stretch it. It's because of the smooth muscle integrity of the colon, it will lose the reflex to tell you when you have to go. So once you get the urge to go, you listen to that urge. You sit fully on the toilet. If you have a squatty potty, great, because that brings the knees up. If you don't, then it's gonna, then you just go into this position where you're resting here and your hands are here. What this does is it straightens the anal rectal angle. So it helps decrease like the pressure at which the poop comes through. So it's a straight chute. And when you're in this position, you'll do 3 diaphragmatic breaths and you'll think about opening the anus. So you're here, 1, and then at the top of the 3rd inhale, open the anus. You're going to bear down like you're trying to fart, but it's almost like a fart that you don't want anyone to see you fart. It's a very small excursion of the pelvic floor. And hopefully your stool is such a good consistency that it just leaves the body and you don't actually ever have to do the push part. So play with that. And it takes, especially with babies, it takes such dedication to make yourself sit on the toilet and do this, right? So
that's what the bouncer's for.
I know.
Yeah. Actually, I had the bouncer in our bathroom until just recently.
That's kind of right.
Yeah.
But I mean, also, how many times are you like nursing and then have to go? Like, it's like you just do it. And so, but just like when you're doing it, just like be like, sit down. You can keep holding baby if you need to, and then just make yourself breathe because we get so conditioned to like, just like, okay, I have to poop, go poop, and then go, you know, and push it out. But really just like start to train your body to breathe the poop out. And this is what I do with my kids too, because it is so, so important to help prevent like hemorrhoids and constipation and fissures and all that stuff.
Look, this is on the wall, right? It's on there. Okay. Okay.
Yeah, but maybe just for more peace.
Yeah.
Oh my gosh, it's so cute though.
She loves mirrors. She loves mirrors.
No, my dad like hung that mirror like
Okay.
the world was falling down. So
Well,
yeah,
at least we know.
right? Yeah, so that's a good thing. But just like doing that type of breath pattern and like working the pelvic floor for every bowel movement, that's an exercise.
Mhm.
Like, and that's a valuable exercise. So just make yourself poop like that, because that is how you'll condition your pelvic floor to get that extensibility. Does that make sense? Cool. What other questions do you guys have? I guess we have like a few more minutes.
Yeah. I realized for myself, I have a pattern of holding my breath.
Yeah.
Does that like connect with like a weaker core? Like, is there a reason that we would do that?
You're probably trying to get more stability
Yeah.
with your breath hold. And so
Okay.
when people are trained like powerlifting or
Mhm.
CrossFit,
Mhm.
they're trained to inhale. So if I was gonna like do a super heavy squat, she totally funny. If I was gonna do a super heavy squat, what you're trained to do is like inhale,
Uh-huh.
fill up your core with your
Yeah.
air. You get your stability from the Valsalva, it's
Mhm.
called, from the breath in, and
Mhm.
then you do the movement all while
Mhm.
holding your breath. And then
Mhm.
you let it go and exhale.
Mhm.
And as females, it's so much harder on our pelvic organs
Yeah.
to do that, because it increases more downward pressure in the vaginal canal.
Mhm.
And so that's why we teach the blow as you go,
Yeah.
shh, because it decreases the
Uh-huh.
pressure in vaginal canal, making it more possible that we'll keep
Uh-huh.
our organs in our bodies.
So
So
this is just everyday life, not just
Yes.
working out. I
Yeah.
like will catch myself
Holding.
holding my breath.
Yeah.
I'm like, what am I doing?
Yeah. But it's good that you're aware of it.
Yeah.
So just make yours like, okay, take a breath.
Yeah.
And I catch myself not breathing deep into my belly. And you
Mhm.
don't always have to be breathing deep into your belly, but sometimes if you're like I'll notice it when I sit on the toilet, like, oh yeah, okay, I need to relax here. Like total deep breath. Once we've had babies, really always and forever, but for sure once you've had a baby, there is no hovering over the toilet seat.
Oh.
Like always sit fully,
Yeah.
like no matter how gross it is.
Yeah. Many toilet paper layers.
Yeah. Yeah.
Yeah.
All those young going out days where everybody's like, yeah, you hovered, you don't want to sit.
I know.
That's years.
Yeah.
Hovering. That's not good.
No, trying to pee through a semi-contracted pelvic floor is not good. Yeah, the other thing like to consider like postpartum is obviously sexual function. So if you feel like any positions are off limits, or as you go back to sex and things feel like, okay, it feels like he's hitting something in that position, or it feels like I'm bracing, try to do the breathing so you're not bracing against it, and so you're not holding pelvic floor. And if that isn't working, then there might be some just like too much tension in some of the muscle groups. That's one of the biggest things for me, that when I know I need to get a pelvic floor tune-up, is when it's like I feel like something's not comfortable during sex, and it's like it feels like he's hitting something or something doesn't feel right, and then I know like, okay, I need to get my pelvic floor worked on. I train glutes and legs 3 days a week, and so that itself will increase the pelvic floor tension. And so it's just having that awareness and being like, okay, after a leg workout, I'm going to do some breathing. I'm going to do some diaphragmatic breathing so it can open pelvic floor. Yeah. Is that helpful? Do you feel like this was you guys got something from this?
Oh, yeah, I think so.
Okay, cool. Yeah, and then like, obviously it's a lifelong, like once you're always going to have these muscles. And if we're not progressing, then I usually say like, we're going to start to regress, It's like with any workout, like in a minute we start to not work out or get out of shape, things aren't as great, right?
Yeah.
But there's always room to like keep improving. And so just start with the breathing, start with some self-scar massage, like get the range of motion of pelvic floor, start to work your hip extension back, especially like you can imagine that like your goal should be maybe 6 months, you want to get your hip extension back. And then that's usually when like you can start training more single leg stuff safely. And then to start building on that to like, if you want to go back to running or more plyometric kind of things. Yeah. If that's your jam,
Never been my jam.
Okay. Well, like
but
that.
More like the deadlift.
Yeah.
And like say
Exactly.
Training, so.
Yeah. But at some point you'll want to chase these people around the playground, like, and
Simple
so,
running.
yes, that kind of ready, playing ready. Yeah, so we retrain the tissue. That's what we're talking about when we like build the pelvic floor, build the lower abs, build the butt back, and build the lats. And then we start to build on that. And that's where you start to add weights to your programming and like get consistent with that. And then there's just a maintenance. Like you can do all the postpartum core work in the world, but if you don't keep your core strong, it's going to regress. And anytime you imagine like you're training for something new or you get pregnant again, you're just going to need to like continue to touch back in with all the bases of the core, pelvic floor especially. Pelvic floor is going to change during each subsequent pregnancy, during marathon training, during whatever training that you're doing. So
Can I ask where posture work kind of falls into all of this?
that's in the retrain the body.
Okay, gotcha.
Yeah.
Are these like in order of what to focus on first?
Yeah.
Is that,
Yeah, and they're all in the book.
Okay, great.
And so like it's the end of the book. It's like page 146. And I really go through like the steps, like work on the scar tissue, get the alignment, work on any adhesions of the muscles.
Okay.
If there's prolapse or any avulsion of the muscle where there was like a full-on tear, and then start to heal those structures. But it's all in the back here.
Great.
And then there's just like a simple little core program in the back. There's the breathing exercise explained. And then just some like simple little core exercises. But just, cool. And it describes where you want to be feeling them too.
Yeah.
So,
thank you.
yeah, I hope you found it helpful.
I did.
It's so good to see you, especially good you, of course. Yeah, when you walked in here, I couldn't believe it was you.
Like,
I'm like,
wait,
how did this,
I know you, but it's been a while.
I know. Your eyebrows look amazing.
Oh, thank you.
Yes.
Oh, she says, what about me?
Yeah,
Your
you
eyebrows
too.
are great too.
We'll end the live stream.
Busy eyebrows.